This episode of the Nurse Practitioner Podcast is sponsored by Dakins. When you're treating persistent, hard-to-heal, or complex wounds, you need a solution you can trust, like Dakins Wound Cleanser. Just how powerful is it? Dakins Wound Cleanser has been proven to kill even highly resistant bacteria, like MRSA and VRE, within only 30 seconds. It's non-cytotoxic, shelf-stable for 2 years, and more cost-effective than other wound cleanser brands. When you need a solution you can count on, ask for Dakins. In this episode of the Nurse Practitioner Podcast, Andrea Dalzell discusses nurses with disabilities. Please welcome onto the show, Andrea Dalzell.
Hi, everyone.
Andrea, please give us a little background information about you and your nursing journey.
So I am a registered nurse for the last 4 years, but a lot of people know me because of the journey that it took for me to actually land my first clinical position as a nurse. And even before that, my position as a nursing student, fighting my way through a nursing program who once thought I would not be able to be a nurse in a wheelchair. It was an extensive process, but another tidbit, I never actually wanted to be a nurse. My goal was to be a lawyer, to go after the doctors that caused me all the pain through my lifetime because I have transverse myelitis and I am a wheelchair user. And during my graduation, my physician and his NP joined in and made sure that I was okay throughout that graduation process. And in my memory book, they wrote, "Please, anything but a lawyer." So I figured if I can't be a lawyer, I'm going to join them and figure out how to cure pain. It's a big goal, big decisions. And I thought I was going to be a doctor. And going the medical school route, I realized I didn't actually like the medical model. I didn't even like the way some doctors talked to me or treated me. So why would I actually want to be a doctor? There had to be a different profession that was all-encompassing of human life. And that's where the nursing profession came in for me.
Great. Thank you for sharing that personal information. What are some of the workplace issues facing nurses with disabilities?
Well, there's a lot of issues that face nurses with disabilities, but let's backtrack before we actually talk about nurses for just 1 second. Disability as a whole is one of those things that makes you cringe sometimes if you have no idea what disability actually means. 9 times out of 10, it's the first time you're exposed to someone with a disability is usually a grandparent when they're sitting in a wheelchair or they're using a cane or a walker. And then what do you associate with that? 9 times out of 10, it's going to be death. So usually disability equals a death sentence in society. But that's not actually the case. So there you have someone with a disability who is now navigating life with this disability in societal premises. And sometimes you're just always fighting the losing battle because the perception is that disability cannot equate to healthy. It cannot equate to being a part of. It is its own separate thing and it needs to be included and it should be special needs and specially cared for. When that's not actually the case. It's just human design. 1 billion people globally live with a disability. And that's just actually acknowledging what disability is for themselves. So imagine all of those other people that don't actually acknowledge that they have a disability that are now a part of that 1 billion. So now let's turn it back to nurses. Nurses, particularly in the workforce, are subjected to some very strenuous conditions. We are dealing with patients on a level that we have never dealt with before post-pandemic. And now we're seeing more nurses that are facing a multitude of not only physical disabilities, but mental disabilities. And we're facing it because the workplace isn't actually adapted to deal with disability in the first place. So for one thing, it would be those nurses that are standing up at the bedside for 12 hours lifting heavier patients without actually having the mechanics to do it or the devices that can make their job easier. Then you can see some with disabilities who don't even go back into the workplace after they've acquired a disability because their workplace in general isn't accessible, whether that is the doorways, the spacing of a room, bathrooms, access to accommodations. And someone would probably think that the ADA covers that, the Americans with Disabilities Act, but that act and that bill is over 30 years old. So we kind of actually need to move forward, but we're stuck in 1990 when that bill was signed.
Thanks for sharing your insights on those dealing with disabilities. How can hospitals be more inclusive of these nurses?
Hospitals can be more inclusive to nurses of a multitude of different backgrounds and disabilities by taking to heart what that EEOC statement means when they put it onto their mission. Every single business adopts the EEOC, which is the Equal Opportunity Employment Claim. It's saying that we are not going to discriminate against race, gender, disability, marital status, military status, anything. But yet, every time a business is erected, where is disability in all of that? There's always going to be a female that's working there that may decide to have a child. And although a child is not considered a disability or being pregnant is not considered a disability, you may need accommodations throughout your pregnancy, whether that mean a different type of ratio with patient care, maybe working from home. How do you go about actually accommodating that? Does your HR representative understand what disability accommodations are? Where did they get their training from? Are they actually getting their training from organizations that know exactly how to deal with accommodations? Moving away from the nurse that may be pregnant or need accommodations throughout the workplace because of a pregnancy, let's talk about someone that may possibly get into an accident, may possibly lose a limb, and want to return to the workforce after healing and recovering. Nurses are at the forefront of healing and getting people to recovery. So now when those people come back into the door and your doors aren't accessible, are you really holding true to that EEOC statement? All hospitals, all healthcare clinics, all facilities outside of healthcare really need to understand what that statement actually means and then be proactive about the people that they're going to be hiring and then those that they're going to be serving.
These are things hospitals can and should implement across the country. Thanks for sharing. Can you tell us a little bit about your personal workplace struggles and how you've overcome them?
Workplace struggles are definitely a dime a dozen. Every other day, there's something new to think about. As a wheelchair user, I'm constantly thinking about my spacing. I'm thinking about my safety. I'm also thinking about my patient's safety. When you think about struggles, we're thinking about what's actually going to stop you or be an obstacle that you're going to have to be working around throughout your daily life. But a wheelchair, there's a wrench there. Everything and anything could possibly happen at any given moment for me. Like for once, I actually popped one of my tires while trying to help a patient. So then I was rolling on a flat for the rest of my shift. Yes, I roll on air tires, and my tires are not full of anything else but air. So if I roll on something like a tack, maybe a needle, or something that's sharp enough, it can puncture my tires and ruin my day, which I then have to work through because I can't just go home in the middle of a work shift. Like someone else who may be able-bodied may not have to deal with that type of a struggle. Another thing for me is being able to deal with my health on a regular basis and still put up to societal pressures of being in the workplace for more than 8 hours, sometimes 12 hours, 5 days a week. Now, for me, that means I have to take off more PTO. And sometimes we feel guilty about taking our PTO. But even more so as a person with a disability, when you're thinking about saving that time for when something really big happens and you need it. I can't afford everyday little mishaps to happen. I have to think 1,000 steps ahead in order to be ahead of what can possibly be a struggle or an obstacle that I have to overcome that day.
We appreciate you being candid about your personal struggles. What's one thing you'd want every nurse out there to know about nurses who roll?
Nurses who rock. I mean, come on. You should kind of be envious of us just a little bit. Nurses who have to stand up for 12 hours while we get to sit. I mean, I know you're laughing, but let's really be real about that. I don't have to have back pain or foot pain at the end of my shift. How are your feet feeling after 12 hours?
All right, thanks so much for taking the time to join us today, Andrea. You can find updates from Andrea's social media accounts at The Seated Nurse. For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, updates, and much more. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks for listening.